everybody, in today's video we are going to demonstrate feeding a dependent patient. Tips to note: obtain meal plan from dietary cart. Never open the lid of patient's food until it's delivered to the patient. Always ensure that the patient doesn't feel rushed when feeding. Do not blow over the patient's food,
but rather let it cool down.
Is hot. To check the temperature of liquid substances, always take a little amount and then put it onto your wrist. Allow the patient to assist to the level in which he or she is capable. Never call the napkin placed on the shoulder of the patient as babe. And then if you are seeing a patient that had stroke, always ensure that the food is gone to the unaffected side, and always check the affected side if there are food particles, and monitor the ability of the patient swallowing.
Yes.
Good afternoon, this is Amy.
Good afternoon.
Please, how are you doing today?
I'm fine.
Okay, thank God. Today it's time for your lunch, so I would go and get your meal from the dietary cart, and then get you prepared for lunch. Right, I'll be back.
Thank you. Yes.
Okay, so I'm back with your meal. Okay, so this is a meal for Georgina Amy.
Yes.
Yes, it's lunch. You requested for rice with meat stew and salad and egg. Yes, and then fruit juice.
Yes.
Okay. For the salad cream, there's mustard in it, and I checked your card and you're allergic to mustard, so I'll put that one aside.
Okay.
Since it's not part of the food, it hasn't contaminated it. Alright. So I'll help you to sit down so that we'll have your meal. Okay. So if you can you raise your legs?
Yes.
Okay. So please flex your legs. Okay. Right. Okay, so then the overtaking the sauce with and then I'll go and dispose of my gloves, wash my hands so that we can eat. With my hands washed and sanitized, we'll then help the patient eat the meal. Always sit at eye level with the patient. You are supposed to use an overbed table, but then since we don't have, we'll try and use our table here. You put a napkin around the patient's shoulder, and then you open the food. You then describe the meal you have to your patient. You let the meal face your patient. So we have your rice, your meat stew, your salad, your egg. This you wouldn't need, so put it on the side. Your fruit juice, your water, your spoon, your napkin, and your two straws. Always have individual straws for the different liquids you have. You then ask the patient which food would you like to begin with. Madam, so please, what would you like to begin with?
I want to take water. It's okay. Thank you.
Okay. So then we'll start with the rice.
Yes.
You make sure the spoon is at right angle, and then the solid food is placed at the tip of the spoon. I'll give you some rice and a little bit of meat.
Thank you.
Alternate between the liquid and solid. So I'll offer you some juice. Give you some rice, salad, and then meat. Are you okay, madam?
I can feed myself.
Do you want to feed yourself? Since we don't have an overbed table, we then use our hand as a table to help the patient feed.
Thank you.
So then you take away the food and put it on your side table, and then you move your overbed table close to the bed. You remove the napkin from the patient, fold it and place it over the leftover meal, and then you assist the patient onto the bed.
With the area sanitized and your hand washed or sanitized, you help the patient in bed.
Madam, please, are you comfortable? Yes. Is there anything you want me to do for you?
No.
Okay, so then the call button is nearby. If anything, just prepare. Thank you very much.
Thank you.
So, as you can see, my patient ate about 75% of the food, so it means that the dietary plan was good in terms of intake. You then record input and output of food intake if necessary. He then sent the leftover food to the canteen. You dispose of it as it's supposed to. Wash your hands, sanitize.